Do you have fears that hold you back? Many of us do. These fears can range from mild anxieties to debilitating phobias. They can prevent us from experiencing life to the fullest. But what if there was a way to confront these fears and regain control? This is where exposure therapy comes in. It's a powerful tool that helps us face our fears head-on. Instead of avoiding what scares us, exposure therapy encourages us to gradually and safely confront those fears. The idea might seem daunting at first. However, with the guidance of a trained therapist, exposure therapy offers a structured and supportive approach to overcoming anxiety and fear. Exposure therapy is a type of cognitive behavioral therapy, or CBT. It's based on the idea that our thoughts, feelings, and behaviors are interconnected. When we avoid something we fear, we reinforce the fear response. Exposure therapy aims to break this cycle. By gradually exposing ourselves to the feared object or situation, we learn that the danger is not as great as our minds perceive it to be. This process helps to reduce the fear response over time. It's important to remember that exposure therapy is not about forcing anyone to do something they're not ready for. It's a collaborative process between therapist and patient. The pace and intensity of exposure are carefully tailored to the individual's needs and progress. There are different types of exposure therapy, each tailored to address specific fears and anxieties. In vivo exposure involves confronting the feared object or situation in real life. For example, someone with a fear of spiders might start by looking at pictures of spiders, then being in the same room as a spider, and eventually working up to holding a spider. Imaginal exposure involves vividly imagining the feared object or situation. This is often used for trauma-related anxieties, where it may not be safe or possible to recreate the traumatic event. Virtual reality exposure utilizes virtual reality technology to create realistic simulations of feared situations. This can be helpful for fears such as flying, public speaking, or heights, where real-life exposure might be difficult or impractical. The type of exposure therapy used will depend on the nature of the fear, the individual's preferences, and the therapist's assessment. Section 4: Effectiveness and Applications. Exposure. Therapy has been proven to be highly effective in treating a wide range of anxiety disorders, including specific phobias, such as fear of spiders, heights, and flying. It is also effective for social anxiety disorder, panic disorder, post-traumatic stress disorder, and obsessive-compulsive disorder. Research has consistently shown that exposure therapy leads to significant reductions in anxiety symptoms and improvements in quality of life. It helps individuals regain control over their lives and participate in activities they once avoided. For example, a study on individuals with a fear of flying found that those who underwent exposure therapy showed significant reductions in their fear and were more likely to fly again compared to those who did not receive the therapy. Section 5. Conclusion: Embracing courage, seeking support. Facing our fears can be a daunting task, but it's important to remember that we are not alone. Exposure therapy offers a proven path to overcoming anxiety and reclaiming our lives. By gradually confronting our fears in a safe and supportive environment, we can learn to manage our anxiety and live more fulfilling lives. It's a journey that requires courage, but the rewards are well worth the effort. If you're struggling with fear or anxiety, please remember that help is available. Reach out to a qualified mental health professional to explore if exposure therapy or other evidence-based treatments are right for you.